everybody, it's Dr. Magnifico from JRsFullVet and Poppy.com. This is my 8-month-old beagle, Fripp. She was spayed not too long ago. I want to do a little follow-up video on her, on spay incision and the things that you should think about and ask about and worry about if your dog is recently spayed. So like I said, she was spayed 8 days ago. This is a beautiful incision that's healing really, really well. There's no redness, there's no swelling, there's no pain, and there's no discharge. A lot of people ask me about post-op swelling. They do get a little bit of swelling here, so I don't know if you can kind of appreciate that there's a little bit of swelling under there. That's really the scar tissue healing, so it's not abnormal to see a little bit of swelling in that incision site, but you shouldn't see any signs of infection, which are pain, swelling, discharge, redness. Those are things to talk to your vet about. In the world of incisions and sutures, these are absorbable sutures, so because they're buried, they're absorbable, but absorbable sutures can take a while to resolve. Sometimes it can take about 2 months. So if your dog is bothered by the knot, you can ask your vet about how to trim it. Usually I just say pull the ends, so the ends of the knot up, and then try to trim very gently just underneath the knot, or even trim through the knot. And if you're worried, just ask your vet to do it. They'd be happy to do it for you. But you want to make sure that it's clean. This is just sort of normal. You know, she's a very active puppy, so that's just very normal. But if the scab falls off and there's no bleeding underneath, then that means that it's really healed. The way that the incision looks on the outside is a really good reflection of how it looks on the inside. So, you know, nice, quiet, healing incision usually means that the inside is doing the same too. I like to keep these guys on restricted activity for 2 weeks, so that's outside on a leash or inside supervised or in a crate. Those are my 3 options. We really want her to be quiet for about 2 weeks so that everything heals internally. There are sutures internally, so there's a suture here internally, a suture here internally, and one down here. And I want to make sure that those sutures and those ligatures stay in place, and it allows that tissue that we remove to heal quietly and normally. So 2 weeks is about a good estimation. If your dog is not bothering the incision, it means that it's healing well. But if your dog is consistently going after the incision, so trying to lick, trying to chew, seems like they can't get comfortable, you really need to see your vet. Don't just put an e-collar on. They're trying to tell you something. They're trying to tell you that it bothers them, and you need to make sure that you're prepared for that. You know, we worry about dehiscence, which is opening of the incision underneath the skin. There's 2 layers that we have to go through, so there's another line of suture underneath, and that's closing the abdominal wall. We want to make sure that's in place. We want to make sure the external is in place. So those 2 layers are really critically important. Just because it looks good on the outside doesn't mean that the inside might not have a problem. So if they're trying to tell you that it's bothering them, listen to them, pay attention to them, and then go find your vet ASAP. You know, any dog who's eating well, drinking well, urinating well, typically those are all really good signs too. So I always ask how the dog is doing. If your dog is really bothered by the incision, go talk to your vet and make sure that you're addressing any signs of abnormal healing or delayed healing or possibly infection or dehiscence. And then after you talk to them about it, put an e-collar on. Usually I say leave the e-collar on for about 3 days so that they don't have access to it. But if you spay your dog young, so anytime under about 8 months old, they tend to really not have any problems, and she has not had one problem at all. The only problem we've had is me trying to keep her quiet and still. If you have any questions about spay or healing or incisions, you can find me at JRsFullVet or Poppy.com. Take care. Bye.